My name is Jan. I am a licensed clinical social worker with Memory Care Home Solutions, which will fall under track 1 of the caregiver training portion of this caregiver training and relief program. We are very excited to be part of this program, and it really is going to help us serve more families in Missouri. Already thus far, we have received, I believe, I have personally seen 3 families on the other side of Columbia that I believe strongly has been referred from the Aging Ahead or Aging Best. That's where they said they've gotten our information. And I strongly believe that's from this outreach already. So thank you. Like I said, we are track 1, the caregiver training portion. And this program, the funding is supported by the Department of Health and Senior Services, a partnership between the Missouri Rural Health Association, the Alzheimer's Association of the Greater Missouri chapter, and Memory Care Home Solutions. So like I said, we are track 1. Memory Care Home Solutions, we are a nonprofit organization. We are based in St. Louis City, but we serve families all over the state of Missouri virtually, and we do see some families kind of on the right over the river in kind of the Metro Illinois area. The mission of Memory Care Home Solutions is to exist to extend and improve quality time at home for families caring for loved ones with memory loss, dementia, or Alzheimer's disease. So we are not an in-home care company. We are an education and training program for caregivers. So we do not provide in-home companionship or light housekeeping or nursing services. We are an education and training program for caregivers. So the staff at Memory Care Home Solutions, here's a few of us, but we are an interdisciplinary team of social workers and occupational therapists. So, and then also our intake specialist is kind of our first line of contact. So if you're making a referral or if you're a family caregiver, our intake specialist, her name is Brittany, and she'll be kind of the first person that you talk to get a better idea of our program, maybe some additional, immediate strategies, and then get signed up. You'll then meet with a social worker and possibly an occupational therapist. So like I said, we are an interdisciplinary team of dementia experts, and we have a few different services that we do offer. So the first service, and the one that pertains mostly to this program, is the customized caregiver consultation and training. So we're going to go more into detail about what that entails a little bit down the road, but that is where it's a very individualized meeting with family members, friends, community members who are involved in caring for a person with suspected or diagnosed cognitive impairment. We also offer education and outreach programs. So we do a lot of trainings for maybe community partners, senior center staff, and just ways to effectively communicate or interact with persons with Alzheimer's disease or another form of dementia. We have a very, so it's a geriatric care counseling program. And this is really if someone is in crisis and they have just an immediate question. They might not be fully enrolled in our program. They just want a quick answer or someone to talk to. We do offer that, but many times, if that's the case, we really refer to the Alzheimer's Association helpline, because we are not a crisis intervention, and we are only available really from 8 to 5. And so we want to make sure that families have the appropriate support. And then lastly, we have a caregiver counseling program. This is a newer program, but we know that caregiver burnout and stress is very prevalent. And so for caregivers who are really struggling with the role transition, how taxing it is to be a caregiver, we talk about stress management and reduction techniques, as well as kind of the grief and loss and a lot of the emotions that come up with caregiving. So there's a very brief introduction to the services we offer. So for memory care home solutions, for that track 1, the caregiver training, we have pretty minimal qualifications. So the first one is there needs to be someone who has suspected or confirmed cognitive impairment. No diagnosis is needed for our services. We also require an informal caregiver. So like I said before, that could be a family member, a friend, a neighbor, a church member, and who's willing and able to work with us. If there is a formal care partner, someone who's being paid, they're welcome to join in the sessions, but we do need that informal person to help us to work with us. For our service area, in-person services, we see in-person people in St. Louis City, St. Louis County, Jefferson County, St. Charles County in Missouri, Madison and St. Clair counties in Illinois. Thanks to this grant opportunity from the Missouri Rural Health Association, we are also able to offer our services statewide. And so that's where we are starting to see people in southern or southwest Missouri and a little bit west of Columbia, because we are able to provide our services virtually now. There's no age limit. And like I stated before, our services are paid through grant funding and most health insurance plans. So briefly discussing our outcomes. Our program has been researched. We've had, some studies done, and it has shown that, when a family and a person with dementia has been enrolled in our program, throughout the year of the program enrollment, the person with dementia has had a decrease in 911 calls, a decrease in hospitalizations, and a decrease in ER visits, which we know are so important in helping slow down the disease. The more that someone's having acute medical conditions or in and out of the hospital or ER, that all affects the progression. And we've seen also, as far as our outcomes, that caregivers express they have a better understanding of the person that they're caring for and their dementia diagnosis. They feel more prepared in their ability, which also increases their confidence in their ability for day-to-day care of the person that they're working with, and that they have found that their ability to manage their own self-care has also improved. I thought this was really important to include in this presentation because memory care home solutions, I know I'm biased, I work here, but we really are such an individualized training program for each family. And I think that why the values are important to go over is because, it's very different than the traditional medical model. Let's say if you're in the hospital, we figure out what something is wrong, we get treatment, and you're on your way. We really want to support the whole family unit and look at the holistic picture of the person with dementia. So we really value compassion, work very individualized family-centered services, empowerment is one of the biggest values that we have, because we want our caregivers, our families to feel like they are capable of caring for the person with dementia. We know that being a caregiver is not intuitive, and it does take many strategies, and it takes practice, and it takes trial and error. So we really want to empower our caregivers to feel that they are capable of doing it. Accessibility, and especially over this past year when everyone had to kind of, pivot and figure out how to deliver services, not only with COVID, but now thanks to the partnership with the Missouri Rural Health Association, accessibility to our services. So whether that is in-home or virtual, we really are working hard to make our services as accessible as they can be to anyone who wants to participate. Collaboration. We do not want to be the end all be all. We work very closely with our families. We do a lot of brainstorming with our families, because although we are the dementia experts, the families are experts in the person that they're caring for. And so it's really a collaborative approach to strategies and meeting families where they're at. And finally, excellence. We very much strive to provide excellent service, and we're very committed to, if we're going to make a referral, we're following up with that resource to ensure that the family was contacted, services were provided, and really just support the family, because we know that there's so much stress and strain that comes on the caregiving role, that anything we can take off of their plate is something we can help with that. So now that I went through kind of the organization and who Memory Care Home Solutions, who we are, I'm going to go through kind of what does track one entail. So again, when we're looking at this grant partnership, it's the Caregiver Training and Relief Program. So Memory Care Home Solutions, the track one is the caregiver training portion of this program. And so it really looks at how can we help as Memory Care Home Solutions, how can we help and connect with families who are caring for someone with memory and thinking changes, age and place in their home for as long and as safe as possible. And so we know that caregivers many times struggle with adapting their communication. They might struggle with keeping a person busy or occupied. They might struggle with getting a person to perform personal care tasks, bathing, using the bathroom appropriately. So our program is really to help support the family caregiver. So upon referral to our program, the family will talk with Brittany, like I stated earlier, and she is our first kind of line of connection. So she's going to get kind of demographic contact information, and then she's going to schedule the first visit with one of three of us, of our licensed clinical social workers. So if they're outside of if the family is outside of the St. Louis and surrounding areas, this first visit is going to be virtual. So we can do Zoom. We have another platform called Doxy. We do FaceTime, but we can also do phone calls. So we try to be very flexible in how can we connect with each family. So this first visit is typically between an hour and 2 hours, kind of just depending on how many family members are present, kind of the priorities that they want to talk about. And so this first visit is really to look at what are some of the most challenging behaviors a family member is having What are the priorities do they want to address? We go into a lot of education into disease management and maybe why a person is having certain symptoms. And then we're also going to connect with resources. So whether that's the Alzheimer's Association through relief funds or Aging Ahead or Aging Best, we really look at what kind of resources the family member might be needing and supporting. So our program is at least a year long. So the family will meet, like I said, initially with one of our licensed clinical social workers. If throughout that visit it's found that services by an occupational therapist could be beneficial, we either can meet virtually with our occupational therapist, or we really will connect you with an occupational therapist in your own community that can kind of come into the home and do a home safety assessment and work hands-on with the family. For all of our families, though, we follow up at 3 and 6 months from the initial visit. So we are open and welcome and encourage family members to reach out to us in between those touch points, but we know some family members don't need that. And so we formally follow up with every family at 3 months from the initial consultation and 6 months from the initial consultation, checking in. How have you been? How has the person with dementia been? Were you able to get connected with resources? Were there any challenges? Have any new symptoms come up? And then we also follow up with families a year from initial contact through a mail survey. Again, just checking in, how are you doing? Like I stated, we encourage and we welcome family members to reach out to us as much or as little as they need. But we typically find that after the initial consultation, we're having many families reach out to us at least once before that 3-month follow-up call with just additional questions or maybe some concerns that they have. So that was kind of the overview of our program. If you are a referral source and you're listening to this presentation, or a family caregiver, there are a few ways that you can refer or get connected with Memory Care Home Solutions. The first one is you can go to our website, www.memorycarehs.org, click on the contact, and then the new clients and referrals button. You can also call our office, 314-645-6247, or you can fax the referral form that you can find on our website at 314-645-6249. If you are a referral source and you're listening to this presentation, like I stated at the very beginning, I believe we've already had 3 families that we've worked with as a result of this grant, which is wonderful. Many times, because caregivers are burdened and overwhelmed, the best way to get a hold of us is for you to actually make that referral. So if you're in a conversation and you're having a conversation with a family member and you're giving them our information, you could potentially, and I encourage you to ask them, is it okay if I give Memory Care Home Solutions your information? Because then we know that that call will be made. So if anyone has any questions, please let me know.
Thank you, Jan. And yes, if there's any questions that you all may have, feel free to unmute yourself and ask those questions. There's also a chat function at the bottom of your screen that you can chat in the chat box your question. We will stay on here for a couple minutes to answer any questions that may come up. As people are jumping off, if they don't have any questions, okay, go ahead.
Okay. I'm just wondering, we have about 160 families that we support here in Ray County, and a great deal of our population is aging. And we have confirmed cases of diagnosis or of dementia and Alzheimer's. My question is about the virtual capability, because not everyone has a computer, not everyone has a smartphone, not everyone has an iPad. So what are the recommendations? Because we can always get them that media, but what would you recommend for that prior to starting this program? Because obviously there won't be any in person. We're out in Ray County, all the way on the other end of the state.
So, without getting additional media, we can meet with family members over the phone. And I know we've done that quite frequently. So even a landline or a cell phone. And I just want to make sure I understand your question, Susan. So are you asking, like, if you all were to provide media for the actual, tablet or whatever, what would that be to be able to provide to families to then meet with us? Okay. So one of I think the most aging friendly devices is called the GrandPad. And so it's similar to an iPad. So it's about the same size, but it's much more user friendly. As far as like, if you all have one of the GrandPads, you are able to kind of set parameters as far as internet capability, sending emails, and it goes off of a data plan. So you don't need Wi-Fi to use the GrandPad. So like I know we have at Memory Care Home Solutions GrandPads that we can loan to families to do virtual visits. And it just kind of goes off of Memory Care's data plan. So you don't need Wi-Fi in the home. Where if you were to use a laptop or an iPad, you can do that, but then you'd also need to be able to provide families with access to Wi-Fi or internet if they don't have it. So I would suggest looking into the GrandPad. But also we have the phone capability. Jill or Candace, do you have any, or even Ben, do you have any other suggestions?
For us, the best way to connect with families has just been through phone. So we, if a family member does not have access to the internet or a computer, typically a telephone phone conference works best for us.
So there isn't an element of the assessment or the intake process you do where you need to visually look at the person in order to be able to assess their needs. I just wanted to be sure of that.
So for the caregiver training portion, we do have some assessment forms that need to be completed. However, if the family does not have access to email or the computer, we can do one of two things. We can mail them out ahead of time, and then, probably schedule it maybe a week or so later than we normally would, just so we could make sure to get the forms back. But we can also, we try to get the forms ahead of time, but we could also do just in the initial consultation when we call, go over all the forms with the family member as well, So no, we don't necessarily need to visually see the person for our assessments.
And I'll add, Susan, my name's Jill and I'm with Memory Care Home Solutions also, is that, a piece of the in-home caregiver training is home safety assessment. So we prefer to visualize with a smart device, the home environment. But if we can't, because the person does not have access, we will talk through, and every family gets sent a packet of information that has, more description about how we recommend you set up a bathroom, or how we recommend you set up, bedroom to create safety zones. So we do prefer to see the home environment, because that's how we can give the most customized advice. But if we can't, we can talk through the setup. But one thing that we do at Memory Care Home Solutions is we always ask to engage more than the primary caregiver. So we like families to invite lots of people to that first meeting. And generally, there will be an adult child or a grandchild, somebody who will have a smartphone and can either send us pictures, or who can join the meeting visually. So we go to a lot of work on the front end to make sure that we're inviting people to that first meeting. And this is like a typical conversation we have, is we'll call the schedule with the spouse, and we'll say, does anybody else help you? And they'll say, oh, my daughter, but she works full time and she wouldn't want to, I don't want to bother her with this meeting. And so then we say, well, would you mind if we call her anyway? And then usually when we call and invite the daughter or whoever it may be, they're always really thrilled that we actually called them, even though their parents didn't want us to call them, So we try to include more than just the primary caregiver in our initial meeting. And we can usually find somebody, if the family is very motivated by the home safety assessment, we can usually find somebody to include who can help us either send photos in advance or use a smartphone to help us see the areas they're concerned about.
Yeah, I'm not seeing it as an obstacle. I'm just hoping to overcome an obstacle before it's one. So if we can get something in place prior to that onboarding, that was why I asked the question.
Yeah, I definitely think, a lot. Thank you, Jill, for adding that. But the Grand Pad would probably be the most user-friendly and less barriers as far as Wi-Fi or internet to look into.
Okay, great. Thank you.
We also had a question in the chat that you might be able to help us address here, Jan. Is it a good idea to have the individual with dementia at the initial meeting?
Oh, great question. Thank you so much for asking that. So it is up to the family is our general statement. However, we know that typically when the person with dementia is involved in that initial meeting, family members do not feel as comfortable to talk about the person as if they weren't there, even though they're right in front of us, and or to talk about some of the difficulties, to talk about some of the challenges that they're having. So, and again, on the front end, just like Jill says, we try to really hard to find as many family members as we can. Brittany's really good at talking to families about, is the person aware of their diagnosis? Can you use the word dementia in front of them? Do they get upset if you start talking about, challenges? So usually what we find is that our visits are most effective for this, this initial visit. Now, follow-up touch points could be different, but for this initial visit, you have to not have the person with dementia involved, just because we have found, and I've been with this organization for over 7 years, and we have found that families are just so much more comfortable when the person is not present and really open to talking about and brainstorming strategies. With that being said, we do visits with the person with dementia present. And so sometimes we might just be kind of talking around things, or I might say, that's a really great question. I'm seeing that there's some that this might be upsetting. I'm going to send you an email about with more information about that later. And then I kind of try and redirect or distract because, we don't want to offend or upset the person that you're caring for.
All right. Thank you, Jan. They said that was very helpful. So thank you.
Good.
Are there any other questions? Feel free to either chat it in the chat or unmute yourself and ask. And if you happen to get off, thank you for joining us today. I just want to make a quick plug before anybody else has any other questions, which you're free to ask. These webinars are being recorded, and they will be up on the MRHA website. So the Missouri Rural Health Association website is mrhassociation.org. I also typed it out in the chat. That way you all can get out there and copy and paste it as well.
And I am also putting Memory Care Home Solutions website in the chat. So you can go there and find, if you want the referral form, if you want to connect with us via the website, just to kind of find out a little bit more about who we are. That's our website as well.